Hello, this is Brianna Lujan, VN49 AM. Um, my first video about the administer an enema, I forgot to answer the questions. So the patient is placed in the left SINS position. How long should the patient retain the enema fluid? For 20 minutes to 2 hours per the book. And then, is there a limit to how many enemas a patient can receive? No more than 3. And can children receive tap water? Okay, I tried looking that up in the book and I couldn't find it, so I googled it. Not exactly sure if I found the right answer. I found saline sodium enema or phosphate enema. I'm not exactly sure why those ones. I tried looking too, but all I was finding was how to actually make the solution at home, so I'm a little unclear, and I'm not even too sure if that's even the right answer, but that's kind of what I found on Google, so I'm not exactly sure. But so this is the second part. I'm going to be doing removing fecal impaction and inserting rectal suppository. So first of all, why is it important to treat a fecal impaction prior to administering oral laxatives? So when you take oral laxatives, you have to drink a lot of liquids in order for your body to pass the feces. And if you are already having some sort of impaction, then that's just going to keep building on and building. And that's what we're trying to prevent. We either want you to pass a BM or be clear. You know what I mean? You don't want to have any sort of blockage, because then that could be really toxic for your body. So it's good to clear the fecal impaction before even adding on any sort of oral laxatives. Is that the only question? Yes. So discussing the technique of the fecal impaction. So I have the doll here. I'll use the same teddy bear. For the fecal impaction, you would do the same thing as administering an enema. You would have the patient in a left side lying SIMS position. So I'm just going to make it a little bit easier for myself. And then what you're going to do is you're going to lubricate your finger. Obviously your hands are going to be gloved. And then you're going to have a lot of lubrication on your finger because you are inserting your finger into the rectum. And so you have it in and you tell the patient, to take deep breaths. I'm going to be going in through your rectal sphincter to feel for any sort of bowel movement that may be stuck in your bowels. So you tell them to take a deep breath and then you stick it in until you feel, but you want to make sure while you're doing this, you could be stimulating the vagus nerve, and that could, the patient could go into bradycardia, and we don't want that. So you just got to be careful when you're doing this. So when you're in there, you're going in, you're kind of trying, mentally taking note of what the consistency is of the feces, and then you want to start kind of, if you can, start pulling a little bit out, and you have a bedpan right here, or just a pan, just something to just pick it out until you get it. So that's for fecal impaction, removing fecal impaction. And then inserting the rectal suppository, the same thing as the other two. You're going to have the person into the left SIMS position, but this time your gloves, you're going to have the suppository with you. You're going to want to make sure you lubricate that too. And you're also lubricating your fingers, because your index finger and obviously the suppository will be going into the rectum. So you tell the patient, take a deep breath. I'm going to be inserting the suppository into your bottom. You might feel some pain, but try to relax and just take some deep breaths. So you're going to insert it into their bottom, and you're going to kind of go at a little bit of a curve, or just whatever the way the flow of your rectum is. You put it in about 4 inches, and then you just, when you take it out, go ahead and cover them back up, and then you let them know that they're going to be holding this in for about 5 to 10 minutes. So you would just cover them up, give them the call light, let them know, hey, when you feel like you need to use the restroom, go ahead and press a call light and I'll come and assist you. And then you come help them to the restroom, whether it be commode, bedpan, brief if they wear a brief. So that's what you would do for the rectal suppository.